Hey everybody, welcome to another great episode of the OIG Roundtable. We're one short. Matt Kachansky on a project today was not able to attend, but I've got two of the three other members of the roundtable. Jaysen Eisengrind, retired executive from HHS OIG and the retired UPIC West director, and Wade McFall, depends where you are in the country, retired assistant special agent in charge from the LA office, now a member of our SIU team, and clearly Wade, who's in Wisconsin. It is now officially winter because he's wearing a fleece. So it must be that time. So we want to continue the conversations that we've been kind of having off and on over the past weeks regarding things like testimony and trials and all of that. And I think we want to spend a little bit of time talking about the getting behind the great curtain of Oz and the fact that on the outside, SIUs and people in the non-law enforcement community, unfortunately, it's a one-way street oftentimes with law enforcement, as Jaysen Eisengrind used to say as part of his many Eisengrind-isms. I'm here to receive information and not give information, but feel free to ask whatever you want. That would be a common response when can I ask a question? Sure, you can ask any questions you want, but I'm here to receive, not give. So, which is very, very anti-Christmas for Jaysen, who loves Christmas. So it's an odd one, but so I think it's important to talk about the fact that in the SIU space, oftentimes there is this level of dormancy. There are these periods of time where there isn't a lot of action going on. And particularly during a sentencing phase or a post-criminal conviction phase, and I think one thing that that is a little bit of a shocker to the general public is the OIG, as great as the resources are that the OIG has, the OIG and a lot of other agencies still need to rely upon outside sources for assistance and information. Here at Advise, we actually are a subcontractor on a number of projects with the U.S. Attorney's offices around the country. And so, that just goes to show you that even the U.S. Attorney's offices still needs to use outside vendors that have subject matter expertise. And I think one of the biggest discernible differences, and Wade, I want to start with you, is, at the OIG, we didn't have on-staff auditors, coders, nurses. We had to go to the UPICs, and we'll talk in a minute with Jaysen about some of the trials and tribulations of having to rely on the UPICs, which are not part of HHS, right? They're a contractor and a vendor to CMS. But one of the things that you have as a great bonus to being on an SIU team is there are in-house auditors, coders, nurses, and a medical staff to help you with things where, if you have a question about something, you can literally just pick up the phone and have a quick phone call, which was not something that could be done on the OIG side, right? So let's start at least talking about how you can cut through some of the fat and get right to the chase on some things, because those resources readily exist in the SIU space for the most part.
Yeah, for the SIU team that I'm working with, we have 3 or maybe 4 now CPC nurse auditors with a great deal of experience. They have a base of knowledge that I clearly don't have. So they're a good resource. I'll reach out to them with questions frequently. They do a lot of when we put somebody on prepayment review, they're the ones that review the medical records that are sent in by the provider to see if they support the claim or not. And then typically, once they've done a number of them and we've kind of formed a pattern, then I will reach out to the provider and, discuss what the results were. But it's always on those calls. I would hate to have one where the CPC is not available because they just have a knowledge base, again, that I wouldn't be able to conduct the interview as thoroughly if I didn't have the one who's making the decision there. And they're always very good at, explaining, typically the provider doesn't agree with the denial rationale from the CPC. And they're always good about explaining, bringing up hyperlinks to certain laws and regulations, and they have their backup on all the information, the decisions they're making. So having them on these types of calls with the provider to kind of give the denial rationale and basically say, because of these records you provided, we come up with an overpayment amount of X dollars. And of course, they don't like that. So the CPCs are invaluable to really handle that end of the discussion and as to why the claims were denied.
Yeah, and that's an important piece of the puzzle is that you get to kind of cut through a lot of that and get right to the, the heart of the matter. And SIUs have oftentimes in-house staff, and that's not always the case. Some of the smaller plans that are out there don't have that. I mean, that's a little bit of where Advise has been making a lot of inroads. Is that as part of our SIU support programs, we're providing that coding, auditing, clinical documentation, subject matter expertise that a smaller SIU might not be able to provide in a full-time resource. But Jaysen, so I want to go to you because, one of the things that creates a bottleneck in an investigation on the OIG side, and we see this and we hear this criticism a lot, is why did this case take 2 years, 3 years, 4 years to get resolved? And oftentimes it's the wheels of justice sometimes move very slowly on certain things, but also it has to do with the fact that at least on the HHS OIG side, they don't have in-house clinical coding and auditing staff. Now, oddly enough, the VA OIG, which has been really growing its healthcare fraud, waste, and abuse team of agents and investigators, they have in-house coding and auditing staff to help. But, in speaking to some of the people at those agencies, they're becoming overwhelmed because right, the number of cases that exist will far exceed the number of resources that are there. But Jaysen, I want to talk to you a little bit from the UPIC perspective, because what I think people that are tuning into these podcasts and are keeping up with these things, while they understand the UPIC and they understand the functions of the UPIC, one of the things that I think oftentimes goes at the wayside is understanding some of that workflow, particularly when it's from an external partner like the OIG, right? So talk a little bit about, things like requests for assistance and requests for information and how it's not carte blanche, meaning that when the OIG sends 100 records to a UPIC, the UPIC just drops everything and gets to work on it, right? There's a process.
Absolutely. So, and you just characterized the categories really well with a request for information and a request for assistance. So, assistance can come in the form of medical review and also data analysis. And OIG has some really good and thorough data programs, but regarding medical review, though, they must rely on pretty much what it can be supplied by the UPIC or the iMedic, depending on the nature of the concern. So, there's a budget for it, and frankly, if it's going to exceed the budget, then CMS, as the business owner of that contract, the UPIC contract, has the ability to throttle the services that can support that investigation. So, you know, the more cooks that are in the kitchen and opinions about, what is the most important thing that needs to happen in all the cases in the United States, or certainly in the geographic area of the UPIC, which in the West was 13 states and 3 Pacific territories, so huge area of concern. Obviously, there's a lot of competition for those priorities. So it's a juggling act. And, the stark truth of it is that the medical and clinical evaluation of a concern is huge in terms of what it is that we're all doing here. So as SIUs, uh, sure, there are technical denials, like a signature is missing or a location code was incorrect or any other number of either errors or schemes that are out there that may not need a clinical assessment. And certainly CPC coders uh, uh, can be very, very useful because it could be technical in terms of the coding, like if it's a valuation and management code and, the provider is just constantly banging away at the highest code possible, that may or may not be needed to look at by a clinician. But the reality is that the yeoman's share of the concerns that are out there have a medical review component. So having the capacity to have a clinical review and one that is supported by a medical director that's overseeing that is going to be hugely important to the operations.
Yeah, and we're noticing that the value of auditors and CPCs and RN CPCs cannot be rated or underestimated. I mean, in a lot of cases, you need to have those eyes on, and obviously that creates some of those inherent delays, right? I mean, 100 records for an auditor that's just sitting around not doing anything, that's a couple of days worth of work. But you think about the fact that some SIUs and the UPICs, it's a limited number of resources, and the volume goes substantially above what those resources can handle in a particular day. And I think that obviously creates some inherent backlogs. So but taking that into consideration, then you've gotten your reviews done, you've moved along, kind of in the same vein of you've gone for months on end without any action being taken on a case. And then all of a sudden you hear that the case has been resolved. If it's a criminal case, there's a sentencing. If it's a civil case, there's a settlement. And then it's a matter of going back and, kind of getting some information. So Wade, I want to go back to you because, one of the issues that always comes up is SIUs will routinely, particularly on a referral made to law enforcement, SIUs will routinely reach out to an investigator or an agent involving the civil or the criminal case, an administrative case, whatever it may be, and ask for updates on a monthly basis or whatever the policy of the SIU is. There's nothing for months, maybe years, and then all of a sudden, somebody is reaching out to you as an investigator at the SIU and asking you for all of this information that you've already given two or three times, and it's really for the purposes of a sentencing or a refresh. And I can understand there's a level of frustration that goes with that. How what do you see as being what's a good way to educate SIUs? Like how does the average investigator come to understand that it's not you, it's me, right? It's not the investigator. It's really just the wheels of justice and the importance of being able to provide that refreshed data. To me, it means that someone is doing something on that case.
Yeah, definitely. And you hit a key point there is it is a one-way street. We're providing information to whoever it is, the law enforcement party, and I've been on both sides of it where I'm getting information from UPICs and ZPICs and different referral sources, and it was a one-way street then. I was, like Jaysen said, I'm accepting information, I'm not giving it out, I'm not really giving updates, and that can be very frustrating, but that's the nature of it. And as you were alluding to, that the SIU investigator basically works up a case, and I'll get to credible allegation of fraud. I think I hound on this a lot, but there's some issues with that. But first, once the case is referred, you're supposed to go in. It's probably different at every SIU, but roughly every 30 days, you should be updating the case, hopefully with some new information. But once the case is referred, there's really nothing you can do but follow up and check and basically wait. So if that means you have to go in every 30 days and say, still waiting a response from the Medicaid office or the FBI or whoever you referred it to, and you have months and months of that same note being taken, that's all you can do to document it. I think part of the problem, and I've talked on this a few times, is the whole credible allegation of fraud mandates, where the workflows kind of say, they walk you down this path that once you've done a certain amount of investigative steps, you're kind of required to do a credible allegation of fraud. And I've broken this down a few times in different discussions, but if you just break it down, it's like, first of all, is it credible? We don't have to define each word, but if you break it down, is it credible? It's an allegation, but the key word is it really fraud? As in a case that someone is going to work as a fraud case, a criminal case, someone's going to go to jail, possibly. It gets back to the whole intent issue if it's a fraud case. So a lot of these investigations that are kind of mandated to be made into a fraud referral. In my opinion, they're not technically the traditional, what we as the OIG would consider fraud. It's more misuse, abuse, those types of things, but not an intentional fraud. And so a lot of the investigations that turn into a credible allegation of fraud, they get sent off. And those are the ones that I think really end up sitting for months and months with no replies, and then you end up getting it back, 6 months later,
Yep.
and they say we're not interested. And it's like, well, it would have been nice to know that 6 months ago, but now at
Right.
this point, at least you get it back. It's declined, and now you can at least go after recoupment of the funds. But I think that's one of the issues, is this credible allegation of fraud. And I've had meetings with some law enforcement partners who were of the same mindset as me, where they're saying, like, you guys are sending these credible allegations of fraud, but it's, you got to think about it, like, is there intent here? Is someone going to jail for this? And in most of the referrals that I see, I wouldn't consider that a valid, legit fraud
Right.
referral that's going to be worked as such.
Well, what's interesting is we spend a lot of time talking about SIU training, and we spend a lot of time talking about the OIG's training. But the one thing that I think is a kind of an area of sort of open, wide discussion is OIGs, particularly HHS OIG, getting training on how SIUs operate. Like, for example, I would get inordinately frustrated when I was an agent when I would get a phone call every month from the same investigator on their $1,000 estimated loss amount. I'd be like, why are you? And I wouldn't say this, but I'd be like, every month they were calling me for an update on a case in which they had $1,000 in loss. And I'm not taking away from the importance of that $1,000 loss, because it's all relative, right? $1,000 loss to a very small plan could be the equivalent of a $5 million loss to, a larger plan. So I readily recognize that. But I think that if I understood the thrust of why that monthly call was being made, and particularly if you have a big case where you've got a lot of plans affected, you're fielding calls, maybe a dozen calls or more from the payers that are there. So there is this, kind of piece of the puzzle where SIUs know their job, OIGs know their job. Oftentimes people at the SIUs know what the OIG is doing, but the OIG doesn't fully understand kind of the SIU piece. And I think that is an area where there certainly could be that ability to greater develop that partnership. And actually, Tim Deneen from Horizon Blue Cross Blue Shield and I at NHCA were talking about that kind of partnership between law enforcement and SIUs, and addressing like the needs of each, because that is an important piece of the puzzle. The OIG needs to understand what an SIU's process is, not just the UPIC. And I think a lot of agents don't even understand the UPIC process, and they're probably the closest to that, as you can get. But so Jaysen, I want to now go back to you, because now, we got to a point where the case has been resolved. All of the questions theoretically have been answered, and we're doing a sentencing or something like that. And one of the biggest pieces of the puzzle in sentencing is the U.S. Probation Department and the creation of the pre-sentence report and the estimation and the loss amounts and the calculations. And, as you know, in my prior life, I was a federal probation officer before I came over to OIG in the early 90s. I was in Brooklyn in the Eastern District, where I did pre-sentence investigations and worked on the PSRs. And, it's from an SIU perspective, I think that and from an agent's perspective also, but I think that from an SIU perspective, if SIU investigators understood how the sentencing guidelines worked, that actually becomes part and parcel, I think, of how an SIU's kind of investigative roadmap can go, right? Because there are things like violation of public trust as an enhancement, the loss amount calculations, which SIUs should be intrinsically involved in, and then just understanding the facts and being able to articulate those facts properly, potentially to the probation department, right?
Absolutely. Again, so the the at that point, the SIUs, the UPICs, the IMEDIC, their involvement will probably step up, and especially when you're talking about managed care. The reality is that calculating loss amounts in a fee-for-service situation is relatively straightforward. There's always twists and turns and complicated issues and whatnot, but in the managed care environment, where it's a capitated program, it's a lot more statistically oriented, and it also just requires depth review of what that loss was as a result of that aberrant behavior. So uh, I would say that organizations like the SIUs can benefit from getting some training in the area of loss calculation, and again, especially in the area of managed care, which is a predominant share of the Medicaid environment now. The other thing is that there will be interesting factors that affect sentencing. So providers can also be considered to be delivering services that are within the realm of public trust. So a violation of public trust possibly can impact their sentence in a negative way for them. So there may be medical review related things that come up again as a result of that. So I would just say that it's complicated, it's negotiable, meaning it can be negotiable in terms of the amount of time and effort that has to go into it, and what it is that a SIU or a UPIC or a IMEDIC can participate in. But it'll definitely be a conversation to be had with the prosecutor's office as well as the investigating entities professionals.
Yeah, and I think that the takeaway for me on this conversation is that on the SIU side, oftentimes an overpayment amount is negotiated, right? Is it 50 cents on the dollar, 75 cents on the dollar? It's very rarely dollar for dollar. And I think that in the world of criminal and civil related investigations that come through, particularly with the sentencing guidelines, it is not uncommon to negotiate a global resolution where there's a criminal and a civil piece in which and I think this is, begrudgingly some people, but bothers people, and particularly as an agent, it would bother me, and it did. Were these instances in which there was $1 million in liability that was criminal, but the U.S. Attorney's Office decides to resolve this by offsetting most of that criminal liability civilly, right? So an instance where there might be $1 million in criminal fraud, where a prosecutor's decision might be, instead of it being $1 million in fraud, we're going to make it 200,000. The rest will be considered civil, and they'll pay a double damage on that. And I think that to some extent, that winds up being a negotiated resolution where the government still feels like it's getting its pound of flesh. There is a criminal adjudication and things of that sort. I think in a lot of instances, providers are more worried about long-term effects of a conviction, and so if they can move a case from criminal to civil, that's obviously an important piece of the puzzle. Or if you're going to have something that has a criminal hook to it, that the amount of time that a white collar criminal is going to spend incarcerated, is not, it's not 20 years or 15 years as the case may be. Although we are seeing these kind of tectonic shifts, right? We're seeing these 50, 60, $100 million frauds that are coming out from the DME and the genetic testing, particularly from COVID, where people are getting 10 and 15-year sentences, that come about as a result of that. So, Wade, I want to go to you for the last kind of word on this, which is what do you see as some of the takeaways? What are the things, if we were given the opportunity to conduct training to the OIG about SIU operations and how they work, and kind of that divergence, and the training being for the purposes of creating a better understanding of each other and the partnership, what are one or two of the top things that the OIG should be knowledgeable about relative to the way an SIU is run?
Well, if I had to pick a few things, the first one would definitely be let them have an idea of what the goals of the SIU are, specifically related to is the main goal to get criminal referrals to the OIG and to other law enforcement agencies, or are we more concerned with recouping money, getting overpayments negotiated, as you said, it's going to be 50 cents on the dollar probably, but is that our goal to get money back to the program, or is our goal to do referrals? And it's not like a zero sum where you can only do one or the other, but each case that's like triaged, you have to look at it, and there should be some uniformity, some consistency, but each case has to be triaged as, is this going to be a referral, hopefully a criminal referral, or are we going to just try and get the money back for it? So that, I think that's the biggest thing that should be discussed. And I think second is something we talked about earlier as well, is the resources that the SIU has in terms of medical review, coders, nurse reviewers, that type of thing, where that can be available to the OIG. Now, granted, we don't want to just open it up and all of a sudden that you need 6 more nurse reviewers, because every case coming through has a request for, medical review,
Right,
when it's maybe not the most efficient way to work the case. But for them to know that those resources are available, and we have, very qualified people, through people like we have it advised here, some of the nurse reviewers and CPCs. Probably a lot of the newer agents, or maybe even experienced agents, don't realize that those resources could be made available. So I think that's another important part.
yeah, I mean, I can't tell you how many calls I've been on with U.S. attorneys' offices around the country where we're doing work for them, and we're on with I'm on with the OIG case agent oftentimes, and kind of helping walk through, here's what our process, here's what we're going to do. We're getting one of our staff on, on those calls, and I think that's an important piece. And kind of as the final piece of this puzzle that we're talking about today is, at the end of the day, oftentimes the delay isn't because of the investigator. It's not because of the UPIC. Sometimes it's just that the U.S. Attorney's Office has shifting priorities and they have heavy caseloads, and it's a slow-moving process, right? It's waiting for records, getting the records, analyzing the records, getting feedback on those records, maybe a million follow-up questions, a million other pieces that have to be obtained along the way. So, oftentimes the SIU is sitting in a thumb twiddling posture, but also an OIG agent could be in a thumb twiddling posture as well, because you're waiting for something that you don't have any control over. So, yeah, it's an ongoing conversation about how do you move a case faster, but also how do the two different organizations, SIUs and the OIG, who really have the same goal, right? Fraud, waste, abuse prevention, detection, and adjudication. How do you get those two to align more? And I think that's where the conversation continues to go. So we'll keep talking about it until people are tired of listening to us. As always, I appreciate your insight. And again, thanks everybody for tuning into this OIG Roundtable. You can get our newsletter, which has the link to the podcasts. Hello at advise, ADVIZE health.com. Catch us on Spotify, catch us on LinkedIn, catch us on YouTube. And for those that tuned in to our LinkedIn Live with Julie Janeway, thank you. We had an overwhelming number of people attend. It was great. We're making an announcement about our November LinkedIn Live, and we'll also be announcing the details of our upcoming January CPC bootcamp for RNs, for nurses. You don't necessarily have to be an RN. You just have to have a license as a nurse somewhere, because we are going to be doing a course that is specifically geared towards the nursing field, looking to make a transition into something other than clinical nursing, using your clinical experience for some other areas of healthcare fraud, waste, and abuse. And so, as always, we thank you for your interest, and we look forward to seeing you on the next OIG Roundtable.